Welcome, everybody, to the 13th webinar in SenzMate's Connecting the Future webinar series, Can AI Make Healthcare Proactive? I'm your host, Jose Garcia. We have a panel of speakers I'll be bringing on one at a time. I'm not going to introduce them just yet. And just giving some time for people to come in. We're going to start in about 50 seconds. And we're doing something a bit different this time. Because we've got this theme in our webinar video. We had an event 2 weeks ago where we're talking about preventative healthcare and that was use cases focused. Now we're talking about the subject a bit more broadly. And this format we've got, and people who are new, some people already know our format. It's a bit different. So 1 hour webinar, and then we have a 1 hour after party, and we're bringing people on from the audience. And I'm actually going to get started. I'm going to bring on our first speaker. Rushika. You may have seen her in our video content. She appeared in a lot of our video content on LinkedIn. I'm going to bring her on, Rushika. And Rushika is a clinical informaticist. And if you're innovating in health AI, you really want to listen to her point of view because she sees what happens after the pilot and the things that, and I think a lot of things, observations she's going to make are things that a lot of solution providers may not know about what's happening with their solutions when they actually get out into the wild. But have I introduced you properly, Rushika? Have I done a good job?
Yes, you have.
Thank you so much for coming. And the reason why I brought you on first is I want you to kind of like set the table for us. And what are you seeing in terms of AI actually making healthcare more proactive right now versus just, and this is a thing I keep on hearing about, is alert fatigue. We're getting a lot of alerts, alerts on their mobile phones, but it's not turning into something. It's not useful.
Yes, absolutely. And I think that's a lesson that we've learned over the last 10 years as we've come to this stage where we're seeing AI actually making more proactive solutions. And so when AI becomes proactive, one of the examples is it can drive earlier, safer, more personalized intervention, clinical intervention, and it's not just more noise. And one of the things that we had with sort of alert fatigue is that having more alerts, it wasn't working anymore. People would just ignore it. And I've seen firsthand in the sort of UK healthcare AI market that we've got to a stage where we're seeing new solutions emerging with new ideas, fresh ideas, with things like AI predicting deterioration, and we've seen that being introduced into NHS hospitals with like News 2 AI, where you can predict deterioration earlier, which then enables faster escalation before patients get to critical decline. We've seen it in primary care, in GP practices, and we've also seen fresh products and fresh solutions like Brain Plus, which deliver more personalized cognitive rehabilitation after stroke in early dementia. And this sort of AI adapts to content in real time and enabling proactive recovery support as opposed to it being more responsive. And so that's just sort of a little roundup and a little glimpse into what's been coming through, and lots of interesting new projects making their way into the NHS and also the private market.
And okay, you know what I was really interested is what I'm hearing is that it's not purely a technological question; it's a business model issue. Is that am I on base there? Is that correct?
Yes, absolutely. I think one of the things we're seeing is sort of layering of systems now, because before we often had one system which we would have a few things feeding into, but now we're getting more cleverer, smaller systems and AI models being layered into the current practice. And And what we're seeing is proactive AI at its best when it works really quietly in the background, enabling sort of workflows to work how they need to work, but really trying to fit into the actual workflow that's already been established. But breaking into that market is also not very easy, because you need to identify a gap and then produce a solution that fits sort of perfectly into that gap. And that's not an easy job, especially for the NHS in the UK, where we often have quite limited resource to buy these solutions. So they really need to be worth the value.
Mind the gap, as they say in London. And I wonder if you could speak to the gaps. You said it's not easy.
No. It's absolutely a challenge. And I think one of the sort of large challenges is that actually in the UK, we are on different systems in different regions. And we are moving towards sort of systems being merged together in certain regions. For example, the East London starting to take on Cerner and then sharing domains. But that's still going on. It's a really big project. And while everyone is still on different systems like Epic and Cerner, it can be quite difficult to produce a solution that can fit into all of them and can actually integrate with all the different kinds of EHRs available. I would say the other challenge that we face is actually clinician confidence. It's really difficult to get all the clinicians to trust new systems, trust new solutions coming in, and getting them also up to speed with the limited resource that can be available. And that's not always just applicable to AI solutions. That's applicable to all digital solutions.
And we have time for one more question, I think. Where do the patients sit in all this? What do they, in terms of AI-driven proactive healthcare, do they have a role?
Absolutely. I would say they probably have the most important role. And patients should be co-creators of AI-enabled care. Their involvement ensures that the tools are safe, inclusive, and actually useful, because especially in this space, we have a lot of wearables which are providing the data from our patients. And if you just even look at glucose monitoring, we're using a lot of that data on virtual wards where clinicians are monitoring their glucose levels, calling them up, reviewing them in time, at the appropriate time. It's so important that these patients are educated, upskilled, and play a role in the design of AI-enabled care. I would say that we've seen a really big emergence. Just even talking about Brain Plus, for example, now engages patients directly in their rehab journey, and the exercises are co-designed within that application. It's very, very important to have them as part of the design process.
And it's interesting to hear what you mentioned about the Cerner and because I am sitting in Silicon Valley. I think it's owned now. It's owned by Oracle, so I closely work with Oracle on that. The biggest challenge, what they talk about, is they moved their headquarters from California to Nashville because the data, where you can find data, where you need users, there are Southern Belt. There are a lot of healthcare related issues are becoming bigger and bigger. And you're absolutely right. I mean, that is one of the observation from some of these systems. Yes, the system can be there, as you said, that without the data and without the patients, it's not useful. Yeah.
And also training, I would say, just to add to one of the challenges, just ensuring that you can often have a system that's fully kitted out, or AI solutions that are fully kitted out, but then we don't know how to use them to their full capacity. And I think that's a really big learning point. Even for seasoned professionals, we often don't know how to utilize it in the best manner, where it can have the greatest impact.
Okay. Thank you so much, Rushika. We're bringing Rushika back for the Q&A. Thank you so much. And Sarah, now Sarah joined us, was it in the after party 2 webinars ago? Now she's on the main stage. Or was it 3 webinars ago?
Yeah, I think it was your last webinar. And yeah, I asked some questions, participated in the after party, and asked a question to the panel. And yeah, it's fascinating. I think a lot of the topics that you cover are extremely sort of close to my heart and my ethos about improving patients' access to care. And now obviously AI is really changing things up, especially within the UK and the NHS. So it's a really, really exciting topic for me to be part of. So thank you for inviting me.
Sarah's got a lot of experience building out solutions. She's based in the UK, so she's very experienced with that market. And you've been at this from on the technology side, but from lots of different angles and lots of different kinds of projects. Have I introduced you properly, Sarah?
Yes, absolutely. I mean, I've worked with the NHS and care providers for a number of years, over 10 years. And as I said, my ethos is looking at ways to improve patients' access to healthcare services using digital technologies. My experience runs from patient appointment booking apps, so something not particularly exciting, all the way to CKD diagnostic tools, mental health solutions. And I think my goal of improving outcomes using data for prevention rather than cure when possible is a massive driver. And I think that's really how AI can help, drive that within the UK and the NHS for sure.
I'm going to ask you a fun question. And by the way, there's 2 audiences to this event, by the way. There's a LinkedIn Live audience. I think we have 25 people on LinkedIn Live, and we have about 90 people on Zoom. If you're in the LinkedIn Live audience and you want to participate in the after party, you got to join us on Zoom, because the LinkedIn Live ends, I think, at the hour mark. And if you're putting in comments and questions in LinkedIn Live, it's going to take a little bit longer. Somebody has to come and bring them in and put them in the chat here, and then we'll get to them. Sarah, what's the most surprising thing you've seen AI successfully predict, where it's predicted a health issue before anybody saw it coming?
Oh, that's an interesting question. I mean, there are quite a few examples, but I think the one that sticks out most to me was an example that comes from iScans a few years ago. I believe it was 2023. DeepMind partnered with a London hospital to train an AI model that could detect, I think, over 50 different eye diseases from retinal scans. And this accuracy was, matching top consultants. So it was, on point. But there was an actual twist with this. The model itself wasn't just spotting disease. It was picking up early signs of systemic illness before anyone expected it. And the researchers actually found that the eye contained subtle markers of cardiovascular risk, like small changes in blood vessels or signs of high blood pressure, long before a person has symptoms. And in all the follow-up studies, AI models have predicted someone's risk of future heart attack from eye scans alone. So no blood test, no ECG, just the picture of the back of your eye. And I think that's a really good reminder that AI doesn't just automate tasks we already understand. It reveals patterns humans can't see in places we weren't even looking. And the research team has actually made this research open source and freely available to use by anyone in any institution worldwide, just really to act as a cornerstone for global efforts to detect and treat blindness using AI. And it was undertaken using something called RepFound, a foundational model for retinal images, and other companies in the UK have sort of levied that and used it for their own eye scans, such as Boots, for example. I had an eye scan recently where they were looking at the back of my eye, and it, the scan took 5 minutes, and they could tell me about my overall health, my eye health. So it was fantastic technology.
Excellent. I'm really excited about that, And especially like people like me, men of my age, we're not going to go in to get tested for things. We just we went to the doctor. If there's something wrong, just tell us. And if they can find it passively, that'd be great. Science fiction. I love science fiction. And what's one proactive, and I don't normally do this. I don't normally do future casting, but I want to do that with you, Sarah. I hope you don't mind.
No, of course, of course. I'm a sci-fi fan like yourself, so I'm happy to answer this one.
Okay, we're putting your Star Trek. There's no hats in Star Trek. You're putting your Star Trek thing on, whatever that is. What's one proactive? What's one proactive AI capability that sounds like science fiction, but I guess it's not secretly convinced. You're going to tell us, but that you believe it's going to happen.
Yeah, absolutely. I mean, there's a lot of there's a lot of things on social media and all over the internet about different things around AI and science fiction, and we won't go into that. But from a health perspective, I personally think that we'll soon see a world where each of us has like an AI health companion, something like a digital twin or health co-pilot that's constantly learning from our own environment, habits, and subtle biological signals to predict and prevent illness. It might sort of live inside your smartwatch, your phone, or even in your home. And it won't just track your steps in sleep. It will listen to how your voice changes, notice your typing slows, track any tiny sort of variations in your movement, or even, I guess, just detect your facial expressions, all of which I suppose can be early signs of things like depression, Parkinson's, or even the dreaded long COVID. And I think right now we already use wearables, we already have voice analysis, but I think these things are the building blocks. And the challenge is stitching everything together safely and ethically. But I think, but the idea that your devices could spot a health problem before you do and nudge you towards care before you even know you're unwell, I don't think it's far-fetched. I think it's just around the corner. And I think this really sort of drives towards what the NHS are looking to do as prevention rather than cure. And I think if we get the privacy and trust piece right, I think it could be the biggest leap towards healthcare that we've ever seen. And that's what I see coming. And I think a lot sooner than we think as well.
I think, a lot of the things that you just said kind of exist in piecemeal fashion within different business cases.
Yeah.
Different places, but they're not. This is where we keep on coming back to business models, because it's like there's little pieces of what you described in lots of different places. In consumer, automotive is developing some of these things too, but they're all over the place. They're not all consolidated. We're going to say goodbye to Sarah. We're bringing on Sarah for the Q&A, and then she's going to be with us for the after party. And I'm just going to remind people in the LinkedIn Live audience, you're invited to the after party, but you're not automatically in the after party. The after party is Zoom only. So we're going to have to get the Zoom webinars link to the LinkedIn Live audience. Thank you so much, Sarah. Don't go away, please. I'm going to take you off screen.
Thank you, Jose.
Thank you. Thank you so much for coming. And I'm going to bring on Melissa. And Melissa, I interviewed like 6 months ago. I didn't get enough clips. I only got 2 clips. I don't know how. We had a great conversation. I really enjoyed talking to her. And then when I finally went to edit, he goes, "We only got 2 clips? We were talking for so long."
We were talking for so long. I think that's the problem.
And I'm so glad you finally joined us for a panel. And the reason why is I thought of you specifically is when I was researching this topic, people kept on bringing up shame and healthcare choices and how that becomes a barrier. And I thought, wait a minute, I've been meaning to get Melissa on, and she talks about this. So I was like, she agreed. Thank you so much for coming. And
thank you for having me back, Jose. I think we've had some great conversations in this space.
And I haven't introduced you properly, because I know you, and I'm just like, oh, I know Melissa. That's not really an introduction, though, is it? I think you've got a new book out, and you speak a lot about communications and marketing to healthcare, and not like you don't come at it from like a technology point of view. You come at it from like, how do you talk to people?
Yeah, from the marketing and communication side, I've spent 20, 25 years in corporate healthcare on the payer side, the provider side, the pharmacy side, and a lot of time in behavioral health. And that's really where, in behavioral health, that's what really inspired me to think a lot more about stigma and shame and all those reasons why people don't get the care. I mean, Sarah had some great examples about preventative care, like with retinal scans. If people are afraid they're of the outcome, or they have other barriers to care that they're concerned about, they're not going to go get the retinal scan or the lung cancer screening or what have you. That could be life-saving.
That comes a lot. I did a webinar on cancer navigating, and we had an after party of that. And somebody who does early screening for breast cancer, he has a private clinic. He can't get people in because people are ashamed. They don't want the stigma of, oh, everybody, I'm going to get, I'm getting a test for cancer. They don't want to say that. They don't want to think that, so they don't go, even though it would benefit them.
And a great example in that same vein is the American Lung Association has been really pushing early lung cancer screenings, and they're targeting former smokers. And what they found is that people are too ashamed to tell their physicians that they're even a former smoker. If they're a current smoker, a lot of times they'll tell them. They're too ashamed because of how the healthcare community treats them. So they don't tell their physicians that they're a former smoker. So then they are not told about these early lung cancer screening opportunities that are really, really life-saving. And so the American Lung Association did a big marketing campaign, and they're still doing it. It's called Save by the Scan. And your viewers can go to savebythescan.com and see if they're eligible. But it's really going after those people who won't get the care because they're too ashamed and afraid, and they've been stigmatized so much by the healthcare community. They don't want to say, yes, I was a smoker for 20 years, and I probably should be getting this life-saving scan.
So specifically health AI companies, I wonder if you can give some advice, because they're not thinking of this. And a lot of the people think rationally. We're going to assume they make every choice they make is rational. How do you talk to people? How do you design? How do you approach people when this is an issue? You may not understand it, but it's an issue that's blocking you. What advice would you give to them?
I think it goes much beyond health AI companies. I think it's our entire healthcare community that really needs to contemplate the human element. Yes, AI is going to get us so much further from an efficiency standpoint, from a diagnostic standpoint, all the different things it's going to bring to us. But people are still people. We're all still healthcare consumers. And a lot of people are living with stigma and shame and fear and anxiety about the health community. You and Rushika just talked about wearables and a little bit around alert fatigue. Well, there's many people out there who are not going to wear the wearables because they're having alert fatigue, or they just don't want to wear the wearables. I mean, think about how far remote patient monitoring has come. A lot of people are not going to take that next step, and they're not motivated. And they're not motivated for all sorts of reasons. So that's really my advice to all these organizations that are trying to do all these amazing life-saving things. Yes, there's a portion of the population that is going to do all this preventative care. Yes, they're going to wear their wearables. Yes, they're going to do the home monitoring, the home diagnostics. But there's a whole nother segment, a big segment of the population that is filled with shame about whether getting cancer screenings. They're fearful of the health community because of a lot of their, real or sort of perceived, challenges in the past, whether it's to themselves or to their communities. You've got the LGBTQ community, where oftentimes they're feeling stigmatized by the healthcare community, being misgendered, what have you. There's so many barriers to care that my recommendation is let's start looking at breaking down those barriers to care so that people can wear the wearables, get the preventative scans, get the home health and the home diagnostics. But it's not just a certain population that has these fears. I mean, same for me, myself. I think I've got a lot of, certain health conditions in my family's history. Do I have anxiety about getting that preventative care? Yeah. So I think it's something that a lot of us experience. And what we can't do with all of this amazing preventative care and all this AI and health tech that's coming down the road, we can't forget about people and their kind of human nature and their fears. We have to help them overcome it. We have to walk alongside them.
So, Melissa, listening to you, I completely agree with that. How, and we talked about healthcare organization, community, and all that. How do you enable the family? I mean, this is a question came to me because one of the thing is I'm into all monitoring and all those kind of things. My wife, she's a physician, but she doesn't get into this or encourage and all that. I keep, talking about that with her. So my question to you is, we are doing the wider community financing and all that. How do you get the families to talk and get into this and encourage each other to challenge each other in the medical term? I know there are Fitbits and the fit part of it, but from a medical side, any advice for them?
Well, we do know in general that the female head of household tends to be the healthcare decision maker. So a lot of healthcare organizations are already targeting their communications to the sort of the female head of household, because that's just how it's historically been done. Who's the consumer, who's the one who actually makes the appointments. But it's really all about that motivation. So how do we get the education out to the family? And then how do we help the family, whether motivating the family, motivating the individual, or helping them motivate their loved ones? I saw that all the time when I was in behavioral health. The people who would normally call for information were the family members, not the individuals, because the individuals will say, I don't need the help, but their family can see that they need the help, whether it's in mental health or substance use disorder. So I think it's really, this is a perfect time for healthcare marketers and healthcare communications people to really step up and say, how are we going to get this education information in digestible formats to the family members, or also something that would motivate those individuals themselves, because not everybody's like you, who's really on top of, every opportunity for prevention and monitoring.
Oh, thank you.
Thank you, Melissa. And Melissa won't be joining us for the after party, but we're bringing her on for the Q&A, and then we're going to be closing the first hour with her. She's going to be giving us her final word. Thank you so much, Melissa. Don't go away just yet.
I'll be here.
Is our next speaker. And I wanted you to, by the way, I think most people know you. And Ruben's in Silicon Valley, and he's been around. He's been in health AI before even people knew about health AI. A long time. You've been on this journey.
Yep.
I think a lot more because we're hearing a lot about health AI the last 2 or 3 years, but it goes way back, starting in life sciences. And I wonder if you could. Have I done a good job of introducing you?
Not yet.
Ham-handed, isn't it?
I can speak a little bit more about it because I think I come from completely a different angle. I am in Silicon Valley 30 plus years. My background is computer engineering and all that. And I've done early 2 of my companies and very successful exits. But what happened was last 10 plus years, I am into angel investment in Silicon Valley, where I'm part of a group called Sandhill Angels. So where about 200 of executives from Silicon Valley, we get together, we try to find the long short games and invest in them at a very early stage to encourage in entrepreneurs. So the reason I'm talking about all this background is majority of, I have about 100 investment as a company, as a group, we have about 3,000 or 4,000 companies we invested. More than 1/3 or 1/4 of the companies in that are addressing some kind of healthcare. I don't know if you guys know the Silicon Valley we talk about now. how it came about with Meta, Facebook, Meta, or Google, all that thing. The biggest winner was Genentech. It was in 1970s, 1980s, 1990s. Genentech, which was using technology to do, because I knew the guy who invested in that, called Byers. He was part of Kleiner Perkins. So I have a lot of history of talking to these people who have done healthcare as for life, but they were in a bigger scale. But with AI, so last 8 to 10 years, I have been very much talking about it. That's how I got associated with SenzMate, because we've been, I'm part of them, because they had the core technology and capability able to do that. What I was able to bring to them was the problems, because it's easier for young people to with very good education, with very good background, to solve problem. But the most important thing about if there are budding entrepreneurs in the group, first you had to find a problem which is large enough, find a problem which you can go and collaborate and solve. And so that is the most important part of it, because if you don't solve a problem which can scale and sell, you won't be able to make money, and money is the eventually to sustain a business. So I try to look at that way. And so now moving into healthcare and proactive versus reactive, all of this area, uh, healthcare is the best technology for AI. Why? It has so much data. Every patient, even if you go every year, every 3 months, or whatever thing, they are collecting so many vitals. And then now it come to all these devices, IoTs, and all the part of it is continuously collecting, and so you have that much of data from that. So that's what I was referring to, like Oracle and all that, because I used to work with various these kind of companies, and they identified this one before a lot of people now jumping into trying to catch up. Their solution is, how do you do that? So from healthcare point of view, I'm now going to a little bit talk about how it is going to work. And if you look at it from a healthcare point of view, do you guys hear any background noise, or I'm okay?
You're okay, Ruben. We don't hear anything.
Okay. So if you look at it from the healthcare point of view, and what happens is, you need a lot of data to start with what you want to do, and then second part of it is it has to be funded well, part of it. But when you look at it, I think one of you guys mentioned about various Epic to Cerner to there are so many different fragmented tools and interfaces. So one thing US had done very well, I think it may be before or during Obama administration, making a regulation to have the electronic health record important for all the health organization to do in US. So we are about 10-15 years ahead of UK potentially on that, because everyone had to have that. I whenever I go to Stanford Healthcare, and they will make sure I get the app, I get the registration, I get everything is communicated through that. At the beginning, it was a really headache and getting through that. But once I got in through, now I have different doctors. Everybody sees the same prescription, same the test I have done, and all those kind of things. So because of that, the data fragmentation has become a better thing. The second one is, always we talk about, when we talk about AI, the quality of the data and the bias. Because if you look at it, the healthcare people talk about most of these drugs or in the medications were developed by using the Caucasian male, or age group, or whatever it is. And now with all these AI, all the data collection, that is becoming a great leveling ground. Not just US, across the globe, you can look at it. So the data quality and the bias can be reduced Like I always bring my daughter, she's doing PhD in AI area. Her modeling area is SLM, small language model. So I talked to her about that. Her thing is, how do you find these gems of data through TikTok, through Twitter, all of these conversation in the different field? It could be medical, it could be other field, and identifying wider community, wider collaboration and all that. So it is important what we are talking about from the data quality and bias part of it. And then, it's now coming to the current generative AI, there is integration into clinical workflows. How do you do that seamlessly? Because that is the most important thing. If you put another burden on the doctors who are already overworked or the health practitioner, it is a mess, what we are talking about. But if I think earlier someone talked about I think Rushika talked about the proactive and all that. I was talking to a Cisco chief architect last week. We have moved past that. Actually, that's a great thing, because you have proactively looking at it. Now the AI can come and give some answers to. It's not like I'm identifying, oh, this is a problem, okay, go and fix it, versus saying, I found this problem, I ran these 5 different cases, and I found this part of it. I can solve and even recommend something. Again, eventually it is between the doctor and the patient, but at least giving that kind of vision, because if the doctors are overworked and they don't have time to do this research and all that, at least giving them narrow down and giving them in their platter, go and talk to the patients about these options, that gives them a lot of part of it. And always, I end with the ethical concerns on all of these part of it. But I think, if you look at the medical history, there has been, somebody, I remember hearing about in 1800s, cutting people open while they are alive to do surgeries and all those kind of things. That is a lot worse than finding this data to improve the healthcare, without, non-invasive way and all that. So I say is, yes, you had to be careful, you had to be concerned and all that. On the other hand, look at the outcome and look at the benefit of what we are all doing on this one. So that's why I think, we as a SenzMate believe in what, we had to go proactively solve some of these problems. That way we can bring down the healthcare cost and improve the quality of people's life standard. And by doing that, we help the humanity. I'm going to leave it at that.
Thank you so much, Ruben. Thank you. And we're bringing Ruben back. He's going to be giving a final word. He's giving the Q&A, and he's going to be in the after party. Hello, Miller.
Hi, Jose. Hi, everyone. Pleasure to meet you again.
Miller is the use case. I call him I don't know if you like being described like this, the use case ninja. And I'm wondering if you can give us your comments on our earlier speakers from a technical point of view.
Definitely. Thank you. So I think I have listened to the conversation from Rushika to Ruban. It was amazing. So we touched upon a lot of things. So Rushika came up with use cases that's currently happening, the problems, the technology is moving towards, where the data is located, and what are the issues accessing those concept and the problems what we have. And I love the fact that Sarah mentioned about some sci-fi technology. So usually my presentation would be what SenzMate do and what kind of areas we working on. So I would consider the applicable problems what Ruben mentioned, which is happening right now, and we are finding a solution and applying to the audience. But mostly the sci-fi based solution, those are more futuristic. So futuristic in the sense they are looking into a problem which is happening for a long time and try to find a solution that can long last for a long time. So they're pouring in huge amount of money and so on. One of the interesting use case I come across, so it's validated even by a Nobel Prize by giving the first, the Nobel Prize for chemistry won by a computer scientist on AlphaFold DeepMind. So this is an interesting use case where, so the ultimate concept is creating a digital twin of your body. So now we have huge amount of biomarkers, genomics data, about the individual. I'm talking about your lifestyle. So we touch upon information, which is we call it participatory sensing. That means you update information voluntarily or through extension service. Then you have digital sensing, so that is your information coming from Fitbit type of your wearable devices. So all these combined information, your past history and your current data, now you have created your digital simulation of your entire body. So your body would be a digital twin. So without testing on you, so the simulation can be happens on digital twins. So this is completely possible with right now technology like Siemens Healthineers, Nvidia, Clara. They both working on this type of technology with the high performance computers, and you can recreate a human body and your symptoms, your practices, lifestyle, and whatever the issue comes in, proactively you identify that, and you can simulate multiple drugs from genomics data and so on. So identifying more predictive futuristic drug discovery for not only your problem, whatever the genome issues or gene issue you have right now that can cause next 100 years of your family tree, that can be solved right now. That's the research where people are working on AlphaFold and programmable immunity, where you're gene editing. So I think I've recently come across an article. HIV, we have figured out the problem. We have found a solution. So now gene editing is possible. We can eliminate the immunity killing the problems of HIV and eliminate that. So this is a sci-fi technology. You can create and simulate. So you don't need to cut open people and a human being or even an animal in this case to harm them. So you can simulate with data. But the important part is how ethically the data was sourced. Not only the human aspect, how ethically the data sourced. GDPR, we have to talk about a lot. Second thing, okay, we talk about high expensive technology researches which can solve our hundreds of problems and so on. But the other end, we targeting an industry which is multi-billion-dollar money-making machine and the Western world where the money is pouring in. We always talk about this. For the past 5 to 6 webinars, we spoke about it. There are 4.5 billion people in Global South where they need sources, and the researchers on that category of audience are very low. So in terms of business model, there is something food for thought. Yes, technology, it's finding solution. Life is immeasurable and it's invaluable. It's unbelievable to measure it in a price value. So you put huge amount of investment to gain that sources. But there is another environment where economic background is hard, where the technology need to be customized in that scale also. It's not a cheap market. If you're considering 4.5 billion people, $1 per head is enough to make $4 billion an annum. So that's a different market model, business model, compared to one person paying you 6 figures for a solution or a service or a healthcare resources. So considering technology, yes, it's go beyond our imagination towards sci-fi, but there is a huge missing piece of the core motivation of healthcare: saving life and creating a proper, healthy, and human society. So I believe we are missing that piece while chasing around high-tech solutions and missing out an important part. So data, we're only moving out from London to East London, as Rushika mentioned. It's not moving from London to India, the rural part where to solve it out. So I think there are homegrown tech solutions, homegrown data sourcing mechanisms, homegrown policies and principles need to embrace. And there are plenty of researches and development happens. Finding out from traditional practices, that's also something happening right now. Chinese medicine to Ayurvedic Siddha medicines, and they're pulling out information, patenting some important points. So there are a lot of way forward. I think still we are scratching the surface of medtech and AI possibilities on futuristic technology solution to cater the entire world. So just take away from my point.
Thank you. I'm going to bring, let's see, I'm going to try doing something which we haven't done before. And
You want all of us to talk at once, or what? Sorry. Just kidding.
oh, we're going to have some surprises. Here he is.
Yay. Okay, it works.
Chris Hemphill has the coolest webinar Zoom background in health technology. and you were on one of my. I had you on a webinar, and you actually wore a lot of hats. And thank you so much for coming on. And I don't know what you're doing right now. I know you've got a podcast. I'm really sorry I missed your last webinar. I told you I was coming. I put my feet up. I was getting ready to watch your webinar. I was lying down, relaxing, and I just fell asleep before it started. And I'm going to catch you on a replay.
It's all gravy. It's all gravy. You did miss out on a great session with a great founder in the physician relations space who's doing some things with artificial intelligence, and I'm really excited about that. But I got a nice jolt, a blast from the very recent past, because we recently featured Melissa Fors Shackelford on our podcast as well, and we've just been good friends for years. So it's a good little reunion that you put together here. Love it. But go ahead. Sorry.
Oh no, I was going to set you up.
Go ahead. Go ahead and set me up.
Because I remember when I first had you on, one of the things that you noticed is, and this is in a previous role at Woebot, that is that lots of things were surfacing that a lot of people, in terms of after-hour usage, and people were bringing things up in the tool that they wouldn't normally bring up or you expect to bring up with a clinician. And I know you do a lot of fellowship. You talk to a lot of people about solution design, and you've thought about this from a lot of different angles. What can Gen AI do to make healthcare more proactive in the mental health space?
Well, you bring up a really strong point, referring to the Woebot days. And for those who don't know me, in the past, I was on leading data science efforts and things like that at Woebot. And Woebot is an application that allows you to have a conversation with a bot when you're having like mental health issues and challenges and things like that. The question, like what the application was doing, and the title of this webinar, "Can AI make healthcare more proactive?" When you bring up the after hours usage and stuff like that, I was new to the digital mental health space back in 2022 when I started there, and it was extremely surprising to see that people were engaging with this application. It wasn't from this predated the Chat GPT popularity of generative AI, so it was still using a tree-based conversational system. But each of the conversations and pathways, flows, and modules that was built and monitored by clinical professionals, people who had a specific expertise with psychology. So just knowing that the engagement is out there, knowing that also, like there's an article I frequently reference from Harvard Business Review a couple of months ago that said it surveyed thousands of users of LLMs. And Jose, can you take just one guess at what the most popular use case was for how people engage their LLMs?
Right now.
Or the chat. Let's see what the chat says.
Is it life advice? Yeah, put them in the. Isn't it like? It's something weird. Is it like life advice or it's mental health?
I didn't see anything from the chat, but anybody who was thinking therapy and companionship got it right. So the mantra that I'm on right now is that it's already happening. Like there are people who are going to these generalized solutions, and for better or for worse, because you can have these LLMs. They're not purpose built for this mental health care use case, but it's the thing that's the fastest for people to talk to in the moment, and they're having these conversations. So what I think needs to happen, like I was emphasizing the expertise that the founders and clinical teams at Woebot brought to the table. like there's a train that you can't stop with regards to people hopping onto these LLMs, not understand like that these things aren't trained under specific therapeutic protocols, but they're being asked to do life advice coaching, and there's even Reddits, TikToks, and things like that where people discuss the types of things that you can do to bypass whatever safety mechanisms are in place to get the thing to pretend to be a therapist. So I think that there is I'm seeing lots of good language and guidance coming out from the American Psychological Association and other entities that are trying to at least get people to drive this thoughtful development towards purpose-built solutions, bringing in for innovators to partner up with clinicians. I'm just data science and engineering. I can't purport to have that clinical expertise, but I can say I'm extremely thankful for the opportunity to work directly with these psychologists, caregivers, and others.
Yeah, Chris, I think you hit it at the right point there with the companion side of it and all that. I was going to mention about a company I got to know. It came from UK to US. It is operating out of, and I see a comment here already from the founder here, a company called MiCare. So what they do is MIICARE, I think that is still the name. And so Kevin Shanmugam is on here. So Jose, if you want to promote him, he can talk a little bit about it. But the overall part of it is exactly what you're saying for the elder care, for the post-surgery care. A lot of these things, you need a companion to remind you about taking the medicine, remind me of motivating them to do these small movement exercises. Just talk to them and saying, what is going on today? Are you doing? And I was talking to Kelvin, and it was amazing what you are saying. And these guys were working with Mayo Clinic and various aspects of it. But what you hit there, it is the most easy because we have a shortage of the psychiatrists, psychologists, and over medication of people into these kind of thing versus just having some companion, just having able to do without guilt. Yeah, I mean, if you're talking to people and there are judgment and all that, these tools are fun actually. People are making it game fun. Talk to these people, and you are right. I mean, I think the healthcare. I didn't answer that way you said, but when I listen to you, I hear that. Yeah.
Well, top 10 concern. We did an analysis on speech patterns. We used natural language processing to identify what was bringing people to the table, what like in these 2 a.m. conversations. And the most one of the most frequent was that surgery use case that you brought up. A lot of people engaging would have fears about upcoming medical events and surgeries, or concerns about their doctors, and they needed some kind of companionship between sessions, and that's what was bringing a lot of them to the table.
Chris, can you stay for the after party?
Unfortunately, I can't. I really want to, but I have to.
He's not a party guy. He goes and get things done.
And the thing is, we've had tons of comments in the chat, but they're comments, they're not questions. So what we're going to do, some people are staying for the after party. Some people aren't. So we're going to say, what we're going to do, and also we cut, this is going to be awkward, we cut the webinar at the hour for YouTube. So we actually wrap up. But by the way, if you're on LinkedIn Live and you want to be in the after party, you got to join us on Zoom. The after party is on Zoom. I know there's like about 20 or 30 people on LinkedIn Live. The event just ends. So if somebody could put the link, the Zoom webinar link in the LinkedIn Live chat so they can join us. I'm wondering if we could, Rushika, we started with you. I wonder if you can give us your final word.
Absolutely. So I think now, after hearing what everyone has to say, I think AI in healthcare will only really be proactive when it's built with the people that it's supposed to care for, so patients, clinicians, and communities. And kind of following on from what Melissa said, I think that's a really big challenge we need to take into consideration that actually we can produce these solutions, but are people actually going to use them? And without the right marketing, we might not be able to reach our goal. And so if we get the basics right, trust, usability, and partnership, I think we can really transform care from where it is now, where it is, I would say, especially in the UK, reactive, to a more prevention-based system. And I think there are other parts of the world that are there. I know the Japanese do operate on a very prevention-based healthcare system, and we should really be learning from all these places that are, I would say, miles ahead of us, and really learning lessons from all the different expertise we have.
Thank you, Rushika. Sarah, final word. Sarah's staying. We're not getting, but final word for the webinar.
Yeah, of course. I mean, I'd like to echo the previous thoughts. I mean, for me, a healthier, smarter UK would be fantastic. And I think, as we've mentioned before, AI isn't about replacing healthcare professionals. It's about empowering them, helping us to spot illness earlier, prevent avoidable admissions, and deliver more personalised care. And I think within the UK, a proactive NHS is possible. And I think AI is just one of the keys to get there. So that's my final thought. Thank you.
Melissa, final word.
I would say, it's been an amazing conversation, and I know this is just the first of kind of a conversation starter, but I think our topic of can AI make healthcare more proactive, I think we really can't talk about making healthcare more proactive without talking about why people delay care and how can we encourage people to feel comfortable seeking care, whether that's in their home or in a physician's office. We need to work on breaking down all those barriers, because none of this AI and healthcare and all the prevention focus and the proactive healthcare model, none of it matters if people aren't willing to accept the care or to take the steps necessary.
You know what you just said really resonates with me. I think actually next year we won't be talking about health AI. We'll just be calling it healthcare. And Ruben, final word.
It is amazing discussion today, guys. I think it talked about everybody in the panelists, Chris coming into that. I think the most important thing I like about what Chris brought up at the end is about the mental health and companionship and able to help them. Because what that is that builds the foundation to do everything else. Because once you are somebody is trusting, somebody is talking, somebody is listening, somebody is able to do those kind of things, everything else is built on that. I think earlier we talked about how the patients get at part of it, because when patients, end of the day, patients are the most critical part of this one, but the providers are as important in between. But to get to them, that foundation has to be set well and transparent way with all that. So as Melissa just mentioned, like previously it was what is next. It is about what is now. How do we get this one going? And so I'm so happy to have this. Like this is our 13th or 14th webinar. We are doing this together. And what I'm seeing is earlier we had to justify why you guys had to spend 1 hour with us. Now it is becoming like people say, only 2 hours you're doing and only every 2 weeks you are doing. I mean, these are all change, isn't it, Jose? I mean, it's amazing network and people. And thank you for all the audience. We get a request for collaborate between SenzMate and worldwide teams. Like every week we are getting 4 to 5 new potential opportunity for us to develop to talk about SenzMate. We are 150 team members strong, but we have a lot of AI in healthcare experience. So anyone is looking for some collaborating engineering partner to develop a product for you, we may have done some components of it. We can build everything for you. So reach out to Pabodi, myself, or Miller, and we'll help you.
Miller, Ninja
Yeah,
Time.
thank you so much, everyone. It's a great honor to participate for 13 times in this session. So, so my takeaway for the day, there are amazing things happens around the world, but my perspective happens mostly on a silo in very specific region. We need to scatter, we need to expand our reaches of R&D and development on proactive AI. It's ultimately unavoidable. So reaching global south, which bring down the issues on data access, because you get accessing more data from billions of people around, and you find new problems, new use cases. Overall, it's good for the humanity. At the same time, it's good for the research and development, especially the problems what we have at the moment in the proactive AI development. So we have to reach global, that create more hyper localized and affordable technology for everyone, especially in the healthcare industry. Yeah, let's rock the world.
Thank you. Chris, surprise guest. I love having you on as a surprise guest.
Well, really appreciate that. Thankful to be a part of this and see this audience. And it's the audience that kind of inspires my point, which is nothing is inevitable. I'm seeing people who are talking about building reinforcement learning with human feedback, incorporating stigma and reasons people delay care into this algorithm. Brian can tell you about it in more detail, obviously. But I'm just seeing good conversations happening among builders and people who have great ideas. And it's just a reminder that even ChatGPT in 2022, the day before that was released, they had no idea. It was an afterthought. They hadn't provisioned even enough server capacity for like this kind of global expansion. It just happened and exploded, and people's lives changed afterwards in ways they didn't predict. So it's just an emphasis on continue building and innovating and connecting with the people that you see here, making the choices to serve the people in the global south and serve the underserved, bring up these ethics issues along with the exciting AI components. And I think we can build a future that we're proud of, but nothing's inevitable.
Thank you to all our speakers. This is the point. Well, I'm going to say goodbye. But we're saying goodbye to YouTube, and we're saying goodbye to quite a few of the speakers. We're about to start the after party. Thank you so much to speakers. Thank you so much for the audience for coming.